Hey, what's up, docs? Dr. Tony Ebel here, PwC Chiropractic. I brought in my communication pro, Dr. Matt Hill, to help me out with this one. Because this is where you really have that moment to change somebody's life at the report of findings. So I wanted to give you a demo and an instructional video here, just super basic but crazy helpful around the report of findings folders. And so obviously you want to do that report of findings somewhere where you have the ability to present, so we use these custom desks here in our office. But basically how it goes, where you are in the camera here is where the patient is sitting across from us. And once we get started, you're actually going to see another product show up on the inside, right? And so the gas versus brake pedal. So for you, minute or two here, right? Going back through that education.
So this is my framework. I actually use the folders throughout everything we want to communicate, as we use it as kind of our roadmap to do some quick education, to set it on the right path, and especially for kiddos and families to make it not all about pain, make it about the nervous system, make it not about the spine, make it about how the body's functioning. And you go through that gas pedal, brake pedal is just so key to follow that down and really set the stage for when you do pull out the scans with the insight to say, okay, here's what the scans are going to tell you.
It's exactly what it is, because on day one with this poster, you set the stage. Now you're reconnecting to that conversation. We want you to think of day one and day two. Yeah, they're two different visits, one conversation. It's seamless. Make that conversation that way. So then on the inside, you're going to see we always then add a NeuroFuse handout as well. And then underneath of that is all of the scans and all of those things. So the second part of this, and what is so great about the folder, and you may have other printouts, so you may do posture pictures, you may have other things that are going to go in this folder. So all your different educational pieces, all your different exam printouts and findings, again, we're an inside substation obsessed office. That's all in there. So the second part, we pull that out, we go through, we're going to explain the exam findings and the scan findings. And the final piece we want to show you, this is where the rubber meets the road, right? What they're really getting out of day two is the plan, the care plan, not treatment plan. Nowhere on this form does it say the word treatment, because that's not what chiropractic is. But I'll go through my paces. Matt, you ideas. There's three parts to that. What we love about the way we design this is that small little snippet at the bottom. Don't forget about it. You want to really future pace and forecast the fact that they're going to be a wellness patient for life. But up top, here's a little bit of our neurological explanation that fits the gas versus brake. Here's their goals, most important thing to anchor the plan to. And then here is where you write their personalized, customized, this many visits per week for this long. Every 12 visits, we're going to redo the scan. So the middle is where, again, we don't have it on this mock-up, but it's where you're going to write out that patient-specific care plan. So that's the final piece.
I love beginning with the end in mind, right? Like a lot of times, you just feel like having a great rapport with someone, skip down to wellness care. Tell them about how, our goal is to get you to that point, what that's going to look like, how we're going to have met those goals to get them there. But to get there, we have to go through repair and restoration. So really, this whole folder guides me through my day two ROF. It's what I use. It's what I've used from the beginning. Helps me stay on track and just helps me communicate at a high level.
It's exactly like every well-aligned product. It's very simple in its structure, flow, and design, so that then the communication becomes powerful, becomes efficient. We want to be always efficient in our practice and really make that connection to those patients. So get these ROF folders for your practice, and you're going to absolutely see your day two connection and conversions just explode.